So do we have something to worry about here? Let's ask Dr. Frank Catachesa, an internist at Northwell Health. Doctor, great to see you again. Should we worry?
Well, we'll get to that in a second. First, I just wanted to welcome you back, Neil. I know this is a topic that's near and dear to your heart, and I'm certainly happy to see you back and looking well and healthy. And we were all worried about you, and I'm glad to see you back. So let's talk about BA.2 for a second. So BA.2 is a subvariant of the Omicron that we've been dealing with for the last 2 or 3 months. It swept through the country. BA.1, the original Omicron, swept through the country about, pretty quickly. A lot of people got it. A lot of people got natural immunity from it, which is a good thing. Now we're seeing this BA.2. They're seeing it in China. They're seeing it in Europe. We're seeing it here. Right now, as of last week, about 23% of the Omicron positivity cases were BA.2. Should we be concerned? Not terribly concerned, Neil. The good thing is it does not seem to cause disease that's any more severe or serious than the original Omicron did. And that was much less severe than Delta and the earlier strains. The interesting thing about BA.2 is that it does seem to be even more transmissible than the very highly transmissible BA.1. So that sounds a little scary when you think about it, because if it's more transmissible, isn't that scarier? Not necessarily, because it does not seem to cause worse disease.
Doctor, if cutting to the chase with the World Health Organization, the latest missive to the world, I guess, we're letting our guard down too soon. A lot of people going back to complete business as usual. They worry that we're taking this lightly, are we?
I don't really see it that way, Neil. If you look at the way China's handling this right now and parts of Europe, and China's shutting down theme parks and they're shutting down whole cities. There's a city or two of a couple of 100,000 people that they're just shutting down. That didn't really work the first time around. If you're trying to accomplish a zero COVID outcome, it doesn't really work very well. We've been trying that for the last 2 years. We tried it here, we've tried it across the globe, and it hasn't really worked. We're really going to have to learn to live with it. And thankfully, these new strains are mild, and except for people who are immunocompromised and the really high-risk populations, it does not seem to be a huge threat. The deaths are down, the hospitalizations are down. Even as cases went up with Omicron, in January and February, the deaths and the hospitalizations didn't tremendously. So no, I don't think that the World Health Organization is correct in saying that we're letting our guard down too soon. It's time to start getting back to normal a little bit. The enormous economic, social implications that the mandates and the shutdowns have caused to our children and across our society, I think the remedy ended up being worse than the disease in a lot of cases.
I just wondered, what do you tell your patients, doctor? I mean, we get mixed messages from some of the big drug companies, Moderna and Pfizer. You need at least 2 shots and a booster, maybe 3 shots, maybe 4 doses, and on we go. Is there a rule of thumb? I mean, I'll take the immunocompromised out of it, of which I'm part, but what do you tell people?
Neil, the rule of thumb is that every patient that walks in the door has a different story and is a different case. And you have to take this on a case-by-case basis. If you were sitting in my office in front of me right now, I would say, Neil, it's important that you stay current and that you get all necessary protection because of your well-known immunocompromised status. If a 20-year-old college kid walked in here and says, do I really need the booster? I'd say, you don't, because you're healthy. Your overall risk of dying of COVID is close to 0. So they probably don't need it. So each case that comes in is different. You have to look at risk factors. You have to look at their overall health and really assess each individual case. This is why the relationship between a doctor and a patient is so important. And going through this past 2 years, I think the whole process has gotten a bit dehumanized. And blanket recommendations across the populations really kind of removed the importance of the doctor-patient relationship, where a doctor can sit down with a patient, go over everything and say, this is right for you, or maybe it's not.
All right, we just have to stay calm, to your point. Doctor, great seeing you again. Thank you very, very much. A little more after this.
Thank you, Neil. Have a great day.